my parents, first of all, because in every step of my life, my parents always help me and support me. So whatever I am, it's only because of my parents. So secondly, I would like to thank to OMICS Research Center, because they like and appreciated my research, and they enable me to present my research in front to all of you. So thanks. I start my presentation. The topic of my presentation is effectiveness of rational emotive behavior therapy, dispute the irrational belief among the drug users. The rationale of my study is irrational beliefs are important psychological constructs which are predict how to individual react emotionally to stress event. Their role of emotional regulation. Indeed, a large body of empirical evidence show that irrational beliefs affect the emotional problems such as self-reported trait anxiety, trait anger, depression, state anxiety, depression, and anger, guilt. When individual develop the such type of irrational beliefs, he turns towards social, emotional, and psychological illness. Addiction is a chronic disease. Albert Ellis proposed that irrational beliefs are the main cause of emotional, psychological, and behavioral disorders. In the light of literature, increasingly irrational beliefs develop the psychological problem and ultimately decrease the addiction ratio. REBT dispute the irrational belief which can decrease the ratio of addiction. Hypothesis. The hypothesis of my research is that there is likely decrease the irrational belief of person with substance use disorder after the treatment of REBT, rational emotive behavior therapy. When individual method. Repeated Meyer design was used. Sample consisted of 12 persons with substance use disorder. It was carried out indoor patient of drug addiction at Punjab Institute of Mental Health and Fountain House, Lahore. Implication and intervention. Pictorial representation of REBT techniques give better understanding and significant results. Participants are highly interested in therapy and enjoy the concept presented with the pictures. Assessment Meyer. Short-term generalized attitude and belief scale was used to assessment the pre and post assessment developed by the 1999. It is a 26-item scale utilizing the 5-point Likert response scale, which responds the ranking from 1 strongly disagree to 5 strongly agree. Higher scores indicate the stronger beliefs. Short-term generalized attitude belief scale. This is a short-term generalized belief scale. Okay, I start my therapy now. A for activating event, B for belief system, C for the emotional consequences, D for disputing the irrational beliefs, and effect, E for effect the new beliefs. Mastering the art of personal happiness. REBT is the mastering art of personal happiness. I can't tell you how to be happy in your life, but I tell you how to create the happiness in your life and stop the feelings that create the unhappiness and miserable situation in your life. So as a clinical psychologist, after having practiced with many unhappy people, can I tell you how to amuse yourself. In this way, REBT helps us to make ourselves rejoice. REBT depends on the ABC model. A for activating event, B for belief system, C for consequences. For example, A for activating event, loss of love. After that, belief system, a person feels is that I am worthless person in this world. Okay, and after this world, a person after the bad activating event, what the person tell himself on his head. For example, when he lost his love, he tell ourselves that I can't stand it. It's really bad. I have lost my love. It is really shameful for me that my lover left me, and I would never be able to find another person like like him or like her. And the world is no more for me. I am such a worthless person. So these beliefs create the unhealthy emotional consequences. The consequences lead the three emotional consequences. The first one is physical, second is emotional, and third one is behavior. Physical consequences is when a person faces the bad activating event, he faces heart rate increase. Physical consequences is increase the heart rate and sweating. And after that, a person feels the emotional consequence. In emotional consequence, he becomes aggressive and fighting with the other person, like family member or his close friend. After that, the change his behavior, he becomes rude and rigid and start addiction. After that, awareness of the ABC model, many persons think that the activating event is the main cause of our bad consequences. Anybody tell me that he also think that? You are all think that activating event is the main cause of our bad consequences? So how is the main cause of our bad consequences? Yeah? No one tell me? No. Okay. I explained the ABC model. Okay. A for activating, B for belief system, C for consequences. Firstly, we face the bad activating event. Then we tell ourselves bad remarks, bad thinking in our head. Oh my God, I can't stand it. My lover left me alone. I will never be able to find another person in my life again. The world is being so selfish and unfair for me. So these are a belief system of a person. After that, a person faces the bad consequences. He faces the depression and uses the addiction. Okay. So what do you think that the main cause of our bad consequences is the activating event or is the belief system? Okay, thank God it's clear now. Okay, so we can start the ABC again with our better understanding with the same activating event but with a new belief and new consequences. So the activating event is the same, loss of love, and belief system is a change. It is unfortunate that I have lost my love. No matter, there are thousands of people who have lost their love. I am not only one. Things are not going to change, and I would not have magic to get back of my love. It's not end of the world. I can choose I can make the such relation with someone else. This thing create the healthy. This thing create the consequences, like a person feels the sadness and annoyance, not face the depression and uses the addiction. Okay, just change the belief system. After that, I gave with them the list of the client, which is based on the different situation that creates the emotional disturbance in their life, like people, family, friends, kids, co-worker, life stressor, traffic jams, people in their life, worlds, and unfairness. After that, I gave them the awareness, unhealthy thinking, and unhealthy emotions. Unhealthy thinking leads to the unhealthy emotions. When a person add the should, must, absolute in his life, this thing create the unhealthy emotions, like the person feel anger, depressed, guilty, shame, hurt, and jealousy feelings, emotions in his life because of their negative, unhealthy thinking. On the other hand, I also explained that the healthy thinking leads to the healthy emotions. if a person add the should must desires in his life, this thing create the healthy emotions. A person feel the disappointment, frustration, sadness, remorse and annoyance in his life. So if we want to be happy in our life, we should change. Firstly, we should change our thinking. Okay. The next slide, I explain them. You have always the choices. Choice 1. Continue demand the people and world. They should act the way you want them and make yourself angry, depressed and guilty. Choice 2. Change your thinking that people are going to act the way they want and not going to act the way I want. It's not end of the world, but I don't know, like a world not gets better because I am making myself upset. Okay, this thing show the emotional trigger. In this picture, I clear the awareness of my client that they take the emotional control of their emotions in their hand. The first picture shows a person happiness because he take the remote control of his emotion in his hand. So he is happy now. The other person shows the sadness because the remote control of his emotion not his hand, because so he is unhappy. The remote control of his emotion is an other person hand, so other person is happy and he is unhappy. Whenever we have faced the bad activating event, for example loss of love, we become depressed, start weeping and start fighting with other family members. And in this situation, we give the remote control of our emotion of our other person's hand, and make the other person make ourselves depressed and anxious and angry. So, if we become happy in our life, we should take the remote control of our emotion in our hand. You feel the way you think. I gave them the awareness related to the example of broken egg. In this activating event, an egg is broken now, and after the bad activating event, the other eggs show the different emotions. One is feel anxious, other is start weeping, and the other is start depressed, and the other show the helpless feelings, and one is start laughing at the situation, and the last one show the hopeless feeling. So this thing create the awareness that you feel the way you think. You would not be able to change the situation, people and world that is around of you, but you should change the way of your thinking related to the situation or related to the event. So your perception, your degree of perception start your happiness in your life. So keep on repeating yourself until you start on believing that I feel the way I think, I feel the way I think. To change the way I need to change the way I think. Okay. This picture show the disputing method. This picture show the scene of a high court. Law is the symbol of disputing, replace the irrational belief, disputing, use the different type of disputing. Accused is the symbol of disputing, and judge is representative to decide. Now the cross questioning start now. Lawyer asks to the accused, are the irrational beliefs are helping you? Accused, yes. Lawyer, how? Accused, my irrational beliefs are helpful for me, as they provide me a shelter and I feel calm and relaxed. I feel free from worries. Furthermore, I feel worthless and the world is no more for me. Lawyer, rejection. It does not mean you are not lovable and adorable. Such rejections are the part of life. You can develop or make the good relation in your life again, and life again spring around of you once again. Just the change the way of your thinking. Accused, silent. After that, lawyer start the logical disputing. Lawyer asks the question, do we always get what we want? Accused, no. I feel as if I was wrong. Accused, judge, on the basis of court proceeding, my verdict is that rationality is win. So the case is dismissed. So at the end, accused feels satisfied and accept the change his way of think. And the other picture show the person happiness because he take all the rational belief in his bag and kick out all the irrational belief in his life. So this picture show the person journey step by step towards the addiction. Firstly, a person face the bad activating or event or disasters in his life. After that, after the bad activating event, a person guilt feeling. The guilt feeling create the unsatisfaction and frustration in his life. This thing create the anger, anxiety, and worthlessness. After that, a person wants to physical relief in his life, so he entered in the evil door of addiction. After that, REBT therapy was applied to help out of that patient to come to get out of the addiction. So REBT therapy apply the step by step of the patient. First of all, awareness related to the REBT therapy. After that, apply the ABC model and replace the irrational belief into the rational belief. After that, disputing of the irrational belief and effects of the new rational beliefs, and end of the therapy, a person is happy now. The advantages of staying calm. When a person take the rational beliefs in his life, a person staying calm in his life. So the advantages of staying calm in his life: you feel better, you like yourself, other people like you, you make better choices, you make fewer mistakes, you handle your problems in a better way. On the other side of the scale, show that the no advantages of being upset. So the health sign showed the drastic double-edged role of the recovered addict because now he helped to the other addict to come back to the life, and change reaction of improvement starts now. Conclusion. No one, please tell you yourself whenever you face any bad activating event. No one can upset me, insult me, put me down, or hurt me without my permission. And other one, I make myself upset, no other or my circumstances. I will take the remote of my control, or the control of my emotions from this moment onwards. And the third one is, I gave them the people right, be wrong, because they will exercise that right, whatever I give into them or not. Progress sheet. After complete my therapy, I gave them the progress sheet, which is based on the different questions related to the REBT therapy. Because I want to know the client opinion related to my therapy. What you learned, what is most useful in this therapy. In high risk situation, what is your beliefs or emotions? What are the signs, thoughts, feelings and behaviors? Therapy goals achieved, mostly achieved or not achieved. Complete the therapy or not. After the end of the therapy, I set their personal goal. Short-term goal, lifetime goal or long-term goal. Results. Wilcoxon Sign test used to examine the effectiveness of rational emotive behavior therapy disputing the irrational beliefs in substance use disorder. Pre-assessment, the result of pre-assessment 48.33 and post-assessment 45.92 and p-value 0.01. To analyze the effectiveness of rational emotive behavior therapy, Coxon sign test was a profound score on irrationality scale were significantly lower to post test compared to the pre-test. The score 3.30, p-value is 0.01. Conclusion. Many people think that drugs taking behavior is one of the best options to escape from tension. When people have bad experience in life, then they become stuck and overgeneralize the experience. Irrationality occurs due to the stuck thinking about the own self related to the people and situation. The present study helpful to resolving patient emotional turmoil, result to emotional beliefs that may put them at the risk of psychological illness and drugs addiction. It may also help the patient to tolerate oneself and others, and helpful the goal achievement to the effectiveness of psychological intervention. After that, I show the data of my 12 patients. There are a number of patients. First of all, activating event. How much time I have?
Well, you have time.
Okay. First of all, activating event, the loss of love, loss of job, and again loss of love. Belief system, world is selfish, I am worthless person in the world, and again world is selfish now. The physical consequences, physical, emotional, and behavior consequences, hot flashes, fighting with the others, family members, or increase the heart rate, sweating, and palpitation and aggression. Reason of emotional disturbance, people in life stressors, and again people in life. Unhealthy thinking and unhealthy emotion must or absolute world add the disturbance in the life, and healthy thinking and healthy emotions add the wishes, desires in the life. Choices continue or stop the demand of the world is up to you. Unhelpful thinking habit, mind filter, judgment, prediction, emotional reasoning. A imagery exercise, create the imagery exercise to make them relax.
We'll have 5 minutes.
Okay. And there is the other slide of show the my client's data. There is the same thing. Can I explain it or not? Okay. Activating event, that of grandpa, loss of friendship, loss of love, and loss of love. No aim of my life. It's belief system. No aim of my life. Not make the friends again. Nobody loves me. No one add in my life again. Okay. Emotional feelings, emotions, consequences. Restlessness, anger, and usually the addiction. Eyes becomes red and burn feeling in the body, anger and addiction, irritation, and hurt feeling, and start the addiction. Okay. Not to use the word of should, must, and absolute in his life, and wishes, desire of your life. You have the choices. Stop the demanding or continue the demanding to the world and people, and mind over unhelpful habit, mind filter, judgment, prediction is the same now. Imagery exercise. Okay. Emotional trigger, take the remote control of your emotion in your hand. You feel the way you think. Explain it with the example of broken egg. Coping statement, give them coping statement related to the patient problem. User disputing technique according to the patient problem. Effect the new belief, advantage of staying calm or advantages or no advantages of being upset. Progressive sheet, and then give them progressive sheet to get the awareness of their therapy goal. Okay, set their personal goal or long-term goal or lifetime goal. The same data. Okay. Thank you.
You know, this is a really very interesting study in the perspective that, you know, when a person who is drug addict enters in the phase of desire, and afterwards you have got a rush and then crash, and after at that time of crash, he or she will commit any crime or whatever. And we know that in the beginning, if this psychotherapy works for some patients, and for some patient chemotherapy works, and for some patients you need to both psychotherapy, like for example Adeela told about REBT process, but in addition, in some of the patients are so difficult to treat that neither psychotherapy nor chemotherapy is effective in these chronic patients, particularly when it comes to real hardcore drugs of abuse, like when you talk about morphine, heroin, or methamphetamine, and several other drugs, you know, even. But there are certain substances, you know, which are not really considered, although they are drugs of abuse, but there is not a lot of physical dependence and tolerance. And what I would like to tell here is by these words that, yes, he says, when it comes to psychotherapy, yes, remote control is in your hands. But you know, what the condition which I am talking with terminal people, like what madam was telling about one case of 82-year who is still on benzodiazepine. In these type of situations, what happens is perhaps the remote control does not remain in your hands. It goes in the hands of that Almighty, you know, unfortunately. And I am not surprised that those who smoke, live 10 years less as compared to normal people. And those who are multi-drug abuser, they live at least 15 years less than normal people. It's actually a statistics which I wanted to share with you. So there is a healthy living and also healthy mind, which has got a lot to do with our actually healthy lifestyle. It has got something